The president's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. And let's begin with the Delta variant. It's now the most prevalent strain in the United States and growing around the world. But we also know the vaccines contain it. So how worried should we be?
Well, if you're not vaccinated, you should be concerned, George, because it's very clear that this is a nasty variant. It has a much greater capability of transmitting from person to person. We know from extensive experience, not only in our own country here in the United States, but in other countries, that the vaccines that we are using work extremely well against the Delta variant, particularly in preventing advanced disease that would lead to hospitalization and likely death in some circumstances. So the vaccines work. I mean, that's the good news, bad news. The bad news is that we have a very nasty variant, and the good news is that we have a vaccine that works against it. That's the reason why we're very concerned, is that we have some sort of a schism between some states and some areas that have a very low level of vaccination, which is really unfortunate because we want to make sure those people are protected for their own safety and their own life, but that of their family and their community.
The schism is deeply infected by politics as well. We have a new poll with the Washington Post. It shows that 93% of Democrats say they're vaccinated or will be vaccinated. Only 49% of Republicans say the same. What can we do about that problem?
You know, George, it's not an easy solution. It really isn't. I mean, what we're trying to do is to just put politics aside. This is no time for politics. This is a public health issue, and viruses and public health don't know the difference between a Democrat, a Republican, or an independent. One of the ways to do that is to get trusted messengers without any political ideology differences out there. That could be clergy, that could be trusted messengers in the community, that could be your family physician, to get people to put aside this political issue and say, what am I going to be able to do for my own safety and for that of my family? We've got to get away from the divisiveness that has really been a problem right from the very beginning with this outbreak.
One of the states with low vaccination rates is Arkansas. The Governor Asa Hutchinson is up next. His state is 44th now in the country, and he said that the lack of full authorization from the FDA is contributing to vaccine hesitancy. How do you respond to that, and how far do you think we are from full authorization?
You know, I think the governor does have a point there. There are certainly some people who, when you use the terminology emergency use authorization, they kind of think it's a tenuous data showing that it's works so that it's safe. That's not the case. In some emergency use authorization for other products, the amount of data just barely gets to show you that the benefit is definitely worth any risk. When you're dealing with the data that we have now, George, you're talking about hundreds of millions of people who've been vaccinated, and in every country you go to, you see that the effectiveness and the safety of the vaccines are very high. So although it's understandable, quite understandable, that some people might say, well, we want to wait for the full approval, that's really only a technical issue. It's the FDA dotting the I's and crossing the T's. But there's no doubt in my mind that these vaccines are going to get full approval because of the extraordinary amount of positive data. But the governor is correct when he says that there are some people who are saying that, who understandably saying, no, I want to wait. What we're trying to do is get the information to them to say that the data are really overwhelming in the positive sense.
One of the big questions going forward is how long that effectiveness of the vaccines lasts. And there's a debate opened up about booster shots, whether they're going to be necessary. Pfizer said this week, they said that a third shot may be necessary after 6 to 12 months. But health officials inside the administration have pushed back pretty hard on that. What do we know about boosters? What do we need to know?
Well, what we need to know is what we're trying to get, and I believe we're going to get that information, George, and that is doing a number of follow-up clinical studies dating back to the original phase 3 trials. We're following individuals for two things: laboratory data that might indicate that what we call a correlative immunity that would be a surrogate to indicate whether or not you still have protection. You follow that over months, and if it goes down below a critical level, that's a red flag that you may need to boost. Another is a pure clinical observation. Namely, are we seeing more breakthrough infections than you might expect? Those are being followed extremely carefully. And we're also simultaneously doing studies preparing for the eventuality of having to boost people. So there's a lot of dynamic things going on right now. We're not at all putting aside, even though the CDC and the FDA correctly said, right now, we don't feel you need a booster. That doesn't mean that we're not very, very actively following and gathering all of this information to see if and when we might need it. And if and when we do, we'll have everything in place to do it. So even though there appears to be a conflict here, there really isn't.
Let's talk about schools. The CDC put out guidance this week urging all schools to open this fall. They said masks not necessary for fully vaccinated students and teachers, but they left most of the key decisions on issues like distancing and whether to wear masks up to the local school districts. That's led to some confusion. Should the guidance be more specific and strict?
Well, the guidance, I think, is pretty explicit there, George. The one thing that's important about what's going on with these new guidelines and recommendations for school, the bottom line is we need to get the children back in school, in-person classes in the fall. And what the CDC is saying, that if you're vaccinated, you don't need to wear a mask. If you're unvaccinated, you should wear a mask. And even though some of the guidelines, like 6 feet versus 3 feet and things like that, even though those are the things you want to pay attention to, if you can't implement them, you should still do everything you can with testing, with guidelines that would allow people, for example, in lunchrooms when you gather, when you're sick, don't come to school. Do everything you can to keep the in-person classes going. That's different than what we've seen before. I mean, the bottom line is a very, very strong push to get the children back in school, but also to do it safely for the children. And that's the reason why you're hearing, if you're vaccinated, you don't need to wear a mask, but if you're unvaccinated, you still should wear a mask.
Dr. Fauci, thanks again for your time and your information this morning.
Thank you for having me, George.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.